name is Bashima Walker, and today I'll be talking to you about Ebola and its effect on the U.S. healthcare industry. During this presentation, I'll talk to you about what Ebola is, how has it affected the U.S. healthcare system, and how are U.S. officials planning to find an effective solution to this pandemic. The Ebola virus is also known as the Ebola hemorrhagic fever. It was named after the Ebola River in Zaire, a city located in the Democratic Republic of the Congo, where it was first discovered in 1979. There have been 13 major outbreaks between 1976 and 2014, with a fatality rate between 50 to 90%, according to the CDC. The CDC has also stated that the starting transmission of Ebola from first humans is still unknown. However, scientists believe transmission started with human contact with an infected animal. They also stated that Ebola is a highly contagious and deadly, and is spread only through blood and other bodily fluids. The Ebola epidemic of 2014 is the largest outgoing outbreak across multiple countries. There are 13,000 reported cases and more than 4,900 deaths, according to the World Health Organization. There have been 13,042 reported cases of Ebola, with nearly 5,000 reported deaths up until the end of November 2nd, according to the World Health Organization. The CDC has reported that they are working with other U.S. government agencies, the World Health Organization, and other domestic and international partners to analyze, contain, and create an effective vaccine. The CDC has also stated that they have deployed teams of public health experts to West Africa and will continue to send experts to the infected countries. The map to the right is a picture provided by the World Health Organization that depicts the scenes of the Ebola outbreak in West Africa. The red dots are the cases of Ebola. Before October 2014, the Ebola had certain guidelines for protection against the infectious diseases. The picture below specifies the guidelines that the CDC has provided. The first picture represents the protective gear that health workers would wear if they were come in contact with infected patients, but not with the contagious body fluids. The second picture shows what the CDC has ordered the healthcare workers wear if they would come in contact with infected patients and bodily fluids. The first picture clearly has an exposed area of the neck between the head and the shoulders. After 2 Dallas healthcare workers contracted the virus from treating a patient, the CDC changed their guidelines, and the picture to the right shows what the workers would wear. As you can see that these are much more protective, and they are much more efficient with protecting against bodily fluids. Because of the CDC's inadequate guidelines, out of the 2 imported cases of Ebola, including 1 death, the 2 locally acquired cases in healthcare workers have been reported in the United States. The 2 healthcare workers who have been cared for at the Texas Health Presbyterian had tested positive for Ebola on October 10th and 15th, 2014, according to the CDC. On October 23rd, another medical health aid worker who volunteered in Guinea at one of the 3 West African nations experiencing an Ebola pandemic was hospitalized in New York City with Ebola, according to the CDC. In 2014, this past month, the CDC issued new guidelines. The new guidelines say that all healthcare workers must undergo rigorous training, are practiced and competent with personal protective equipment, including putting on and taking off in a systematic manner. The CDC also stated that no skin is to be exposed when the protective gear is to be worn. They also said that all workers are supervised by a trained monitor who watches each worker putting on and taking off the protective gear. This is all to protect the healthcare workers who come in contact with infected patients. According to the CDC, there is no FDA-approved medicine or vaccine available for the treatment of the Ebola virus. However, they also report that ZMapp, which is an experimental drug, is being developed by MAP Biopharmaceuticals Incorporated. It is an experimental treatment for the use of individuals affected with the Ebola virus. But MAP Biopharmaceuticals Incorporated reports that it is in very limited supply, so it cannot be purchased and is not yet available for general use. The CDC also states that the U.S. government, specifically the NIH, which is the National Institute of Allergy and Infectious Diseases, the Department of Defense's Defense Threat Reduction Agency, has provided support for the development of this experimental treatment. The cost of developing a vaccine, from research and discovery to product registration, is estimated to be between $200 and $500 million per vaccine. It is not yet known how long it will take to produce an FDA-approved vaccine suitable for human treatment. Some solutions for the Ebola pandemic. The CDC has issued a warning level 3 notice for U.S. citizens to avoid non-essential travel to West African nations of Guinea, Liberia, and Sierra Leone. The CDC states that the CDC and the Customs and Border Protection are conducting enhanced entry-level screenings at 5 major U.S. airports for all U.S.-bound air travelers who have been to Liberia, Sierra Leone, or Guinea. The U.S. government is working with several biopharmaceutical companies to find effective treatment for Ebola in its patients. The CDC has issued more effective guidelines for all U.S. healthcare systems and hospitals so patients with contagious illness can be treated effectively. So today, I have told you how the Ebola is a rare and deadly disease caused by infection with one of the Ebola virus strands. The Ebola outbreak of 2014 is the largest outbreak in history. This outbreak is the first Ebola epidemic in history, according to the CDC. Criticism of the CDC's lax guidelines have caused a reevaluation of the U.S. healthcare procedures on treating infectious diseases. The U.S. government and many biopharmaceutical companies are trying to create an effective Ebola vaccine, although it is unknown how long it may take. The U.S. government, the World Health Organization, and the CDC are working to contain an effective solution to the spread of the Ebola pandemic. Although the Ebola is an extreme and deadly virus and it has infected a huge part of West Africa, the CDC is trying to find an effective solution. So here I conclude my presentation. Is there any questions? No? Well, thank you for listening to my presentation.